How do you design secure software for medical devices?
We've got several different levels of security we've got to consider. I guess the most obvious one is, do you need to secure the software on the device? You need to ensure that the software that the device is running is valid software for that device. It was produced by someone who is authorized to give you software for that device. And we do that by signing the software with a cryptographic signature. We can also use a less strenuous checksum to make sure that the software is valid. That kind of checks the integrity of the software within itself. But it doesn't tell you that the person who created the software is authorized. Another thing we need to do is look at communication at the edge of the device. What does it need to communicate with, and how do we ensure that that communication is secure and authorized?
Why is security important to medical device software?
In the medical setting, I think it brings a lot of urgency to the classic security properties of confidentiality, integrity, and availability. Confidentiality, because you're potentially dealing with sensitive patient medical data. Integrity, which is some of the stuff that you touched on, Dan. You need to ensure that the program, that the software that's running is the right software and provided by the right people, so it's trustworthy. And then availability is also important because a medical device cannot fail in the middle of an operation. And I think availability is sort of a traditionally underrated security feature because it doesn't matter that much if a random IT service goes down, but it's a lot more important in medical.
What can threaten the security of medical device software?
But obviously there's threat of immediate physical harm in many medical device situations. A somewhat tangential concern is that hospital ransomware.
Okay.
So that's not, like, IT in hospitals is not a medical device, but the security of those systems is also very important for medical outcomes, because there have been many examples of ransomware taking over hospital systems and preventing doctors and nurses from doing their work. Software systems that are classified as medical devices that have a lot of sensitive data. So I think just data leaks are a definite security concern.
Explain the different levels of medical software security.
62304 actually uses an ABC classification. Class A is the lowest level. Class C is the light endangering level of safety and security.
Okay.
Yeah, I would definitely throw in a reference to IEC 62304. That's the medical device software lifecycle standard. So it is software specific, yeah.